Health officials on Vancouver Island say they are dealing with an extremely rare outbreak of cholera. And the culprit, they say, is herring eggs. Tashana with more on a most interesting and most unusual story. Good morning.
Good morning, Heather. That's right. Health officials in Vancouver Island are seriously concerned about these instances of cholera. We've heard from Island Health as well as the First Nation health authorities, and they are saying that there is a huge warning going out. They're trying to tell people to not eat herring eggs. So they've discovered a handful of cases. This is after people who became sick were tested and tested positively for cholera. These people, of course, had eaten the herring eggs, and cholera causes nausea, it causes vomiting, severe watery diarrhea, as well as dehydration. So health officials issuing this warning for herring eggs, which can be found on kelp, seaweed, other surfaces, and in particular, it's a specific area near the island, so from French Creek to Qualicum Bay. So all of the patients are First Nations. They had consumed these herring eggs. This, of course, is a traditional food amongst a number of Indigenous communities. It's also associated with the coming of spring. So many people would typically be enjoying that at this time, but health officials are saying a special warning, be careful and look out for signs. And some people who are infected might not actually know. So they're asking people to be vigilant at this time.
It's interesting learning that on average, Canada gets 2 cases of cholera a year and has since 2014. So this already looking at 4. They continue to investigate, as you say, Tashana. Island Health and First Nations Health Authority, what are they looking at?
Well, we know the BC Centre for Disease Control is now investigating, and they're going to be looking at a few things. So, number one, they'll be testing the waters as well, marine water, to see how things are looking. They're also going to be looking at leftover food samples as well. That is a big concern. And also look at or assess the handling and distribution of herring eggs. Now, we've heard from Dr. Shannon Waters. She is she's a medical health officer with Island Health, and here's what she had to say. She says that they are taking this outbreak seriously.
This is a unique situation, as historically having Vibrio cholera infection testing results is exclusively from travelers from endemic areas. None of the cases that we have identified are people who have traveled, and the association has been with herring eggs.
So health officials are saying people make sure you wash your hands. Also, if you are caring for someone who is ill, be cautious and please throw away and discard any stored eggs.